Hi, everyone, and welcome to today's webinar Wednesday. Today's topic is beryllium, an important but not well-known public health issue presented by Gregory Nichols. So Gregory brings over 25 years of experience in healthcare, occupational and environmental health, and homeland security. He is the Health Studies Operation Manager at the Oak Ridge Institute for Science and Education, where he oversees daily program operations and manages the DOE's Beryllium Associated Work Registry. Gregory also chairs the Risk Communication Subcommittee for Beryllium Health and Safety Committee, an international organization dedicated to preventing beryllium-related illnesses. Known for his expertise in evaluating risks of emerging technologies in public health and communicating complex risks, Gregory has published and presented extensively. He holds a degree in philosophy and public health from the University of Tennessee, along with multiple other professional credentials. A U.S. Navy veteran, Gregory served 5 years as hospital corpsman in both domestic and overseas assignments. So with that, I'm going to turn it over to Gregory.
Hey, thank you, Ashley. And thank you to everybody for spending part of your Wednesday with me. So beryllium is a really interesting thing. And when I first started my public health career over 15 years ago, I didn't know much about it other than what I learned in some basic chemistry classes. But when I volunteered to present this webinar, I thought beryllium would make a really great case study in worker health and safety to show how we as public health professionals often work through a problem at multiple stages, beginning with hazard identification, gathering evidence through epidemiological analysis, using that data to develop policies and regulations, and then eventually implementing interventions to reduce risk. Then hopefully I'll be able to paint that picture for you here today. Before we begin, I want to give you a little bit of background on the Oak Ridge Institute for Science and Education, or ORISE, and clear up any confusion, because you'll see that my email address ends in oru.org, but the slide format has ORISE all over it. So ORISE is a U.S. Department of Energy asset that is managed by Oak Ridge Associated Universities, ORAU, a 501c3 not-for-profit organization based in Oak Ridge, Tennessee. Several of the worker health and safety programs within the Department of Energy, or DOE, are managed by the Health Studies Group at ORISE, and so hopefully that connects some dots better. So today we're going to cover a lot of ground in less than an hour. So we'll start with a basic overview of beryllium, then we'll jump right into discussing the health effects and occupational hazards, or occupational standards. Then after that, I'm going to cover DOE's experience with beryllium, because it plays a very important part of this entire story. Then we'll cover some lessons learned and best practices before finally looking towards the future directions and wrapping everything up for the day. So like I said in the beginning, I think the beryllium story really exemplifies what we do in public health and in occupational health and safety. And many of us on the webinar today are CPH holders, so I wanted to emphasize how aspects of the public health discipline and the core areas that we practice fit neatly into what we'll cover today, and in beryllium health and safety overall. So the burning question, probably all you have, what is beryllium? So beryllium is one of those things that is really amazing and really dangerous all at the same time. However, using proper controls and well thought out processes can help minimize the risk. Beryllium is often called a wonder material because it has so many useful properties, and because of these, it is perfectly suited for certain industries like aerospace, nuclear power, and electronics. Beryllium is not naturally found in a pure form. It comes in a variety of mineral ores, but the most common are bertamite, which is the principal source of beryllium in the United States, and then beryl, which is typically mined in the rest of the world. And if you're thinking to yourself that beryl there on the right looks like a little emerald, you would be correct. One of the forms of beryl is emerald, but there are no concerns here as the beryllium is tightly bound chemically and it is inert in this form. So beryllium was discovered by this guy, Louis-Nicolas Vauquelin, a French chemist in 1798. It was not used very much until after World War I, when the first viable extraction process was successfully developed. And we'll discuss more on the next slide, but beryllium use really expanded greatly during World War II. So during World War II, almost every country on Earth had ramped up manufacturing and research and development for the war. Since beryllium had all of the right properties for use in nuclear weapons production, airplane manufacturing, electronics, and other areas, and since it was relatively easy to produce at this point, the use of it skyrocketed in just a matter of a few years. And this is the link that we'll discuss later with the Department of Energy. DOE's predecessor agency, the Atomic Energy Commission, or AEC, grew directly out of the activities of the Manhattan Project, which, as most of you know, was the massive effort by the United States and its allies to develop the first nuclear weapons. Since beryllium was a key asset in the production of weapons during and after the war, AEC began developing guidelines for its use fairly early on. Now, they didn't quite get everything right, but these early efforts did pave the way for the robust measures that we now see across industries that use beryllium. So they really set the standard for how beryllium health and safety developed. So when we look at beryllium, there are three major health effects that we need to consider. First is beryllium sensitization, which is an immune reaction to beryllium, and we'll talk more about that shortly. The interesting thing about sensitization is that it is a necessary condition for developing the next health effect, chronic beryllium disease, or CBD. CBD is really what we are trying to prevent because it is a debilitating and progressive disease with no known cure. Lastly, beryllium is also known carcinogen and likely cause of lung cancer. But in terms of burden of disease, CBD is the one that really keeps everyone up at night. Very quickly, there are two main passive exposure to beryllium. The primary route is inhalation, and this is the one that we try to prevent using engineering controls and personal protective equipment. Prevention is aimed at minimizing the production of dust or particles of beryllium and then protecting the pathways into the lungs. Additionally, if beryllium comes in contact with the skin, it could lead to sensitization, but it is very unlikely. It is not sufficient to cause CVD. So this is the immunological response that I mentioned earlier, and it plays a critical role in not just sensitization, but setting up the pathway that ultimately could lead to the development of chronic beryllium disease. I will note that not everyone who becomes sensitized to beryllium will develop CBD. And we do know that some individuals have a variation of the HLA-DPB1 gene that increases their susceptibility to beryllium. I mentioned before that CBD cannot develop unless an individual is sensitized. So this is why we place so much importance on minimizing exposure and identifying sensitization as early as possible. Our key tool in all of this is the beryllium lymphocyte proliferation test, or the BELPT. You can see in the diagram that this test measures the body's lymphocyte response to a beryllium antigen. And I will just show you that test measures this response right here. This is a very complex test. It actually takes about 2 weeks to complete, and only 3 labs in the country can perform it. In terms of epidemiology, we know some stuff about beryllium, but we really would like to know a lot more. However, studying beryllium exposure is challenging because there really aren't that many people who work with it, and data are limited. One of the best tools that we do have to study beryllium and its health effects is DOE's Beryllium-Associated Worker Registry, which we will describe a little bit later. A couple things that are important I want to point out. The sensitization rate, we talked about how important sensitization is. Generally, on average, it's somewhere between 2 and 6% of individuals who are exposed to beryllium will become sensitized. When you look at the Department of Energy cohorts, that rate narrows a little bit to around 2 to 3%. Another challenge that we see with understanding beryllium is the latency. It has a very broad and varying latency period. So after sensitization, if someone doesn't develop CBD, it could be anywhere from less than a year all the way up to 40 years after beryllium exposure. So it's very difficult sometimes to gauge that period of time. So before we move on to discussing the occupational standards, I want to talk a little bit more about chronic beryllium disease. CBD is not the easiest diagnosis to make, and it usually requires a set of multiple tests and studies and an evaluation by a board-certified physician who has experience working with CBD cases. You can see a picture here of some tissue of lung that has beryllium in the fibrosis inside of it. Um, there are a multiple array of tests that are often used and compiled together to create that clear picture of whether or not somebody does have chronic beryllium disease. One of the first things that we look for is that sensitization that can be done with the blood test, or the lymphocyte proliferation test can also be used in bronchoalveolar lavage, where somebody is intubated and then they take a like a washing basically of the lung tissue, and we can analyze that to see whether or not there's sensitization in that specimen. There's also a series of imaging that's often done mixed with spirometry and pulmonary function tests to test for lung function and capacity. So this is a bit of an eye chart, but I think it's a very nice timeline that kind of succinctly puts some of the significant events and the development of beryllium health and safety standards into a nice picture here. So very briefly, I want to point out a few important dates in this timeline. You can see that we started getting reports of beryllium disease from Germany in the 1930s, and then more cases in the US were reported in the early 1940s. These early cases were workers who used beryllium in the manufacturing of fluorescent lamps primarily. In 1948, we get the first exposure limit from the Atomic Energy Commission, which, as I mentioned, was DOE's predecessor. In 1971, about a year after the Occupational Safety and Health Act is passed, OSHA sets the first permissible exposure limit for beryllium. And if you notice, it's the same limit as what AEC had been using since 1948. So that's why I pointed out the importance of the Department of Energy in this entire beryllium history and this story. So also in the 70s, the International Agency for Research on Cancer, or IARC, released its first monograph listing beryllium as reasonably anticipated to be carcinogenic. So finally, I want to point out that in 1999, DOE passed its final rule establishing the Chronic Beryllium Disease Prevention Program, aimed at significantly reducing beryllium exposure and the burden of disease across the entire complex. And we'll look more at the progression of that regulation here in a little bit. So I won't go through all of these, but I just wanted to give you an idea of what exposure limits exist for beryllium. And you can see that both DOE and OSHA set the limit at 0.2 micrograms per cubic meter at an 8-hour time-weighted average, so throughout a typical workday. And I want to stress one more time that all of these organizations and health and safety professionals and medical professionals that work with individuals who handle beryllium really have to stress and recognize the importance of detecting beryllium sensitization early. So that is always a key aspect of managing beryllium exposure and prevention is understanding the sensitization early on, and then taking appropriate measures after that to reduce and minimize beryllium exposure once someone has become sensitized. So we're about to discuss the Department of Energy's role in all of this, but before we move on, I want to highlight 6 key aspects of a solid beryllium exposure reduction program. And so the first two, hazard assessment and monitoring, and then hierarchy of controls, focus more on the industrial hygiene side, but they look at minimizing beryllium dust exposure and protecting workers. Medical surveillance includes using the beryllium lymphocyte proliferation test to identify sensitized workers and then remove them from future beryllium work. That's a very important aspect once someone is identified as sensitization. And then the last 3 areas, worker education and training, investigating accidents and near misses, and then risk and hazard communication, are 3 very critical administrative functions that provide so much impact to ensuring workers are knowledgeable of risks and also what resources are available to them. This area here is where I spent a lot of my time, especially with the Beryllium Health and Safety Committee, working with folks to develop tools and resources that they can then use to educate not just practitioners and other professionals, but also workers themselves on some of the risk and hazards associated with working around beryllium. All right, we are going to turn now to the Department of Energy and really talk about their story and how they fit into this whole beryllium history. I won't go much further into this aspect here since we covered most of it on an earlier slide. But I will say that Dewey's experience with beryllium has provided a roadmap for process improvement and how it is extremely important to continue to evaluate and refine worker health and safety programs as you get new and updated information. So just to recap a few things about beryllium health and safety across the Dewey complex. We talked about some of the early measures taken to protect workers from beryllium beginning in the late 1940s. In 1999, as I mentioned earlier, DOE implemented 10 CFR 850, which established regulations for the chronic beryllium disease prevention program. And part of that regulation created a registry to track exposures and health outcomes of workers who handle beryllium. There was an implementation period of 3 years, so the Beryllium Associated Worker Registry officially became active in 2002. So we'll spend a few minutes talking about the Beryllium Registry, and I'll show you a nice graphic using registry data that I think nicely illustrates the impact all of this had on DOE beryllium operations. So the Beryllium Associated Worker Registry, or BAR, as we call it, currently contains multiple types of data on over 57,000 workers at 39 reporting organizations. Some of those are inactive sites because they have been closed by the Department of Energy, but we still track the workers who used to work those sites. BAR is unique in a lot of ways because it tracks both exposure and health outcomes related to that exposure. And it is also de-identified, so we don't know exactly who is in the registry. The sites report that information twice a year, and that information is just collected in the registry and then used to conduct the data analysis annually. This maintains maximum privacy, but it also limits our ability to use BAR for some analyses. But nonetheless, BAR has proven to be an effective tool for program benchmarking and policy development. I personally am quite partial to BAR because it's one of the projects I manage with a small team under the guidance of our DOE program manager, Miss Callie Crosby. If you'd like to check out BAR, it is publicly available and it can be accessed to the website on the slide. And I will provide this later if you don't have a chance to copy it before I move on. So we're going to end the DOE portion of this talk with what I think is a fantastic representation of public health, occupational health and safety, and risk reduction in action. You can see from the graph that we have beryllium sensitization cases in gray, and we've got CBD cases in red. The blue line here going across the middle of the chart represents the number of BELPTs, those the testing that's been performed over time. So we do have some early data before BAR existed. And so if you look here, you can see that the BAR started in 2002, like I mentioned. And then 1999 is when the chronic beryllium disease prevention program became inactive. So there's that 3-year implementation window here. If you look at some of the data that was collected before that ended up in the BAR, you can see prior to 1999, we had some pretty high annual sensitization cases, number of cases here, right? And you can even see some of the CBD cases, starting to increase. And you can also see that once we establish this program, once the Department of Energy establishes this program, and then the BAR goes into action, you can see that cases appear to go up. But if you remember, CBD has that latency period, right? So these cases would have been related to exposures that happened back here, correct? Maybe almost up to 40 years before then. So once these new measures came into effect here, and we'll talk more about that, you can see the changes moving forward. So you'll also note that sensitization cases seem to dramatically rise as testing increased, right? So the rule goes into effect here. You can see the increase in cases, or I'm sorry, the increase in testing. You can also see the increase in sensitization. But this is attributable to surveillance bias. So if you remember from some of your basic epidemiology, if we start testing and looking for things, we're going to find them, correct? So DOE purposefully wanted to test everybody who was working around beryllium to identify those early cases of sensitization early. And so that's exactly what we're seeing here. So once you begin to test and you know exactly what you're dealing with, then you can begin to implement those measures to try to reduce that risk. But the more striking thing that you can actually see are that the measures put in place here, beginning in 1999, moving forward, really seem to be working as both the sensitization rates, the cases here, as you can see in gray, are definitely going down. And then the CBD cases in red have decreased dramatically as well. So if you look at this graph, even if you don't know the story of what I just shared with you can clearly see that something has changed right in the middle here, right? And we are seeing a major reduction in both cases, instances of sensitization and chronic Beryllium disease. And that's exactly what the intended effect of the implementation of this program was supposed to be. So we're going to start landing this plane, but I wanted to make a few comments on future directions. So first of all, process improvement is an extremely important aspect of effective management for any health program. So these are a few things to consider when managing a complex program, such as what we found with Beryllium. I will add that the Beryllium health and safety community is extremely diverse. So building partnerships across disciplines and organizations is critical to success. So on a daily basis, I deal with data analysts, IT folks who help manage the registry and the associated website with that. I work with epidemiologists. I work with other public health professionals, medical staff, physicians, nurses, and then also industrial hygienists, toxicologists. So a very diverse group of people who are all involved in managing brilliant health and safety efforts across the Department of Energy, but also I get to talk to some folks in the industry, and there's a similar mix of industrial hygienists and safety people and medical professionals as well. So another thing that we need to consider is forecasting into the future for new areas of concern, right? As technology changes, there's always going to be the introduction of some new risk. And so we need to track that. And especially with Beryllium, we do have some new uses that we're keeping an eye on, and also the reemergence of some, I won't say older risks, but maybe some kind of constant risks that we just need to continue to track. So first, with the rapid development of nanotechnology, we're seeing some uses of engineered nanoparticles of beryllium and beryllium compounds. Nanotechnology is another area that I have supported, and so I could give an entire course on nanomaterials themselves, but these particles of unique physical chemical properties are extremely tiny, and they may not behave in the same way as the mesoscale, the normal size beryllium does. So that's another area of emerging concern as technology advances. Also, new reactor technologies like some small modular reactors, which you may have heard about on the news. They're becoming pretty popular these days. They're beginning to be built at certain sites across the United States. Some of those use beryllium in new forms like molten salts. And so the health data on these compounds is limited or non-existent. The majority of the beryllium that is used across DOE and in other industries is mainly used to make tools and parts and things like that. And so a lot of what happens is in the machining or the manufacturing or the grinding process, that's when those particles are released. And so we understand what that particular exposure and that pathway looks like. And in fact, in the Department of Energy regulations, there's a very specific definition of beryllium. So everybody's kind of used to that, and we understand that looks like. When you look at something like these molten salts, they are different chemical compounds, they are liquid in form, so they potentially behave differently, and we don't exactly know or fully understand the pathways and how they test for potential exposure. So there's still a lot of areas of developing interest that we have with some of these new technologies. And finally, one other thing that's kind of been a problem for a long time, but it's starting to enter the beryllium exposure space a little bit, is the electronic waste recycling. So if you remember from one of the earlier slides, we talked about beryllium being an important component in the electronics industry. And so as we have a lot more electronic equipment that is being sent to landfills and being recycled, we have the potential for some of those pieces, circuit boards and things like that to have beryllium in them. So through the processing of that electronic waste, workers could potentially be exposed to some beryllium hazards. And so that's another area that we are kind of keeping an eye on in the beryllium community overall. All right, so on the research side, we listed a few things here that we thought were interesting, and some gaps in the beryllium literature, and then just kind of our understanding of beryllium in general. So these are some great opportunities for future research. And if you're just beginning your public health career and you have an interest in this and exposure, occupational health and safety, occupational epidemiology, then you might have some opportunities to break new ground. So as I mentioned a couple of things earlier when we talked about the epidemiology of beryllium, there are some things that we don't quite have a great handle on. One of those is that latency period, right? It's a very broad range right now, so it would be nice to get some better information to try to pinpoint that specific time to help us, project and improve worker health and safety programs and medical surveillance programs and things like that. So that's one area. Mortality studies. There isn't a lot of information on that, and working with beryllium workers and comparing their risks and their mortality information with the general population would be of interest. And also looking at like some comorbidities, right? Looking at people who work with beryllium versus other impacts from smoking and other respiratory conditions, right? That may, impact the development of their disease or the likelihood of them developing disease or things like that. So one other thing that from a public health perspective would be really interesting is looking more at the economic analysis, right? So we know that there's a lot of resources placed into identifying sensitized workers, into controlling the exposure risk and things like that. But those initial investments do pay off in the end, right? As we are maintaining the well-being of workers so that they don't develop disease later on, but also trying to understand that economic impact, right? Of how much we're actually, you know, improving well-being by investing in these programs early on, right? That whole prevention aspect, but also what is that burden of disease in terms of an economic analysis, right? And when that shed a little bit of light on how important it is to invest more in prevention and occupational health and exposure programs for beryllium. So that's another area of interest. All right. So we made it a little bit sooner than I expected, but I think that's fine because hopefully we'll have a little bit of time for some questions and a nice discussion because I know that this is not a topic that comes up very often in general public health conversations. So hopefully we'll get a chance to talk some more. But let's finally land this plane. So I want to emphasize a few key points for our time together today. Number one, beryllium is a critical but hazardous material requiring strict controls. I think everybody has hopefully got a little taste of how important, but also potentially hazardous beryllium is, and why it's so important to control that exposure as much as possible. Number two, DOE's historical experience really did shape the current best practices, right? They were one of the first major organizations working with beryllium and really taking this issue seriously. And so a lot of the early interventions, including exposure limits, were set by what was the Atomic Energy Commission that became the Department of Energy. So a very critical component in this entire story. Number three, ongoing vigilance is needed to protect workers. So if you remember the graph that I showed, and we could really see, especially in the Department of Energy, the payoff that we are getting, you know, from the beginning of the implementation of the chronic beryllium disease prevention programs moving forward, how much it appears that the burden of disease is decreasing as we continue to be vigilant in the exposure protocols that have been in place. But also, we have to remember that we don't want to let our foot off the gas, right? That burden of disease, those low exposure levels are there because of all the work that's been done. So it's important to remember that we need to continue to push that, right? Those prevention programs and the risk and hazard management are extremely important. So letting off, taking our foot off the gas a little bit, might change that outcome. So that's something that we definitely want to keep an eye on and make sure that have that constant vigilance. And then also looking forward, right? Like I mentioned, some of these future and emerging risks. So we know what the passes look like, we know where we currently are, but what's coming and how do we prepare for these new technologies and the implementation of these new risks into occupational environments, and how do we prepare ourselves as public health professionals, occupational health and safety professionals to meet the needs of these new technologies to protect the health and safety of workers. And then finally, number 4, compliance with standards saves lives and minimizes the likelihood of developing disease. And so kind of going back to that graph again, you can kind of recall in your mind really that decreasing level of sensitization and chronic beryllium disease cases, right? How important it is to continue to implement programs that reduce risk and reduce the burden of disease and reduce exposure, right? So finally, I wanted to put a list of some resources here that I think may be very helpful. I know I covered a lot of information pretty fast, and like I said, hopefully we'll get a chance to talk here in a couple minutes. But these resources go into much greater detail than what I was able to present today. So if you have an opportunity and an interest, I would encourage you to go check these out. And at any time, I'll have my contact information up on the next slide. But if you have any questions, you can feel free to reach out to me about beryllium in general, about any of these resources, about anything else that we talked about today, or if you didn't get a question answered, obviously I would love to talk to you some more. I will also make the slide deck available. I'll work with Ashley. We'll figure out the best way to do that. You can contact me directly, or there might be some other way to do that. Again, because I know you may have not had enough time to write something down, or try to take a screenshot and I moved on too fast. So I'll make sure if you're interested in the slides that we can get those to you. And with that, I thank everybody for your time today, and I will open it up to questions.
All right. Well, thank you so much. Very interesting topic. Definitely something I didn't know anything about before this. So thanks. So if you have any questions, you can put those in the Q&A section, and we'll ask Gregory now. So I do have the first question I have is, if beryllium is so dangerous and could lead to so many health problems, then why don't we use something else?
That is a great question. The short answer is there isn't anything else that is as good and can do the things that beryllium do. There's been some research looking at using some newer compounds. One of the more commonly used compounds of beryllium is a beryllium copper mixture that's used to strengthen springs, like industrial springs and switches and things like that. So there's been some research to look at using instead of beryllium, things like tungsten or titanium mixed with copper. There's been some limited success, but the beryllium just has the right amount of chemical and physical properties that just makes it such a wonderful material to work with. And it's got a wide range of things, right? It is non-sparking, so it's great for making tools and parts when you don't want an explosion, like when you're making a nuclear reactor or something like that. It has a very high melting point, so it's great for uses in ceramics and heat shields and things like that. So there just really isn't another material yet that we have found that has the same properties as beryllium.
Great. Thank you so much. Victoria asks, she said, I'm sorry if she missed this. She was a few minutes late, but how did you get into studying beryllium as a line of work?
Uh, that's a great question. So I kind of stumbled into it, honestly. I I graduated with my MPH from the University of Tennessee in 2010. And so for that program, you're required to do either a thesis or a practicum, and most people opt for the practicum. So I actually did my practicum at ORU, the company that manages ORISE. So back in started 2009, I did my practicum here, and it was on something else, not related to Beryllium at all. But in talking to the folks that manage these programs, obviously I got a little bit of a taste of that, and then I ended up staying on here after my practicum. So I worked at ORU for 7 years. And it's kind of funny because I did a lot more with more general public health stuff and emergency management, and I also worked on some radiation protection programs. And then I left ORU and I worked at another couple other companies, and then I came back to ORU about a year and a half ago, back into this program, and had an opportunity to be the operations manager, but also manage this program. So I had a very high level familiarity with Beryllium, but it was really when I took over managing the Beryllium registry that I just kind of started to do this deep dive so I could catch up. So I was able to understand some of those unique hazards of beryllium and why this particular program is so important and how it fits into the greater scope of what DOE does and some other industries. So
Yeah, great. Our next question is, are there any mandatory tests for industrial workers to detect beryllium exposure?
yeah, so certainly within the Department of Energy world, there are very strict regulations and guidelines on what beryllium workers need to have. There are a number of things that have to happen. That the most important test, the one that's required, is that beryllium lymphocyte proliferation test, the BELPT. So if you are a beryllium worker in the Department of Energy, you'll get a baseline test, and then every year you get an annual test. And then once you, even after you are removed from beryllium work or you no longer work in a beryllium area, there's still requirements to do frequent testing. I think it's every 3 years after that. In the general industry side, OSHA has similar regulations. One of those resources I put up there actually has the OSHA requirements, and then I think there's some links inside that document that takes you to more of the specific medical surveillance requirements for OSHA. But that again, they recommend the BELPT. So that's kind of the screening test that is like the gold standard right now. So many other things that often happen are more on the industrial hygiene side, with air sampling and white sampling. So looking at the environments, looking at the air, and then surfaces. So those tests are often conducted on a frequent basis by industrial hygienists. And actually, in the Beryllium registry, there is industrial hygiene data that is submitted as well with the medical data that we get. So.
Great, great.
Hmm.
Melissa's asking, are workers informed prior to starting their positions that the positions include beryllium exposure, and are they informed of the health risks? Is that
Yes, so that is one of the fundamental pieces to all of this. The majority of workers who work around beryllium often are aware of it because they may have worked at beryllium at another site. But one of the foundational things is that risk and hazard communication. So like within the Department of Energy, and then even in there are some international regulations. I do work with some folks from Canada, the United Kingdom, and EU. There are some very strict requirements on what workers need to know and how that risk needs to be communicated regarding beryllium. Within Department of Energy, there are very well prescribed hazard communication. I won't call them, I guess it could be programs, right? Kind of along the lines of the OSHA HAZCOM standard, right? But beryllium risks and hazards are communicated with those workers. So each worker that is being assigned to a a job that involves beryllium is very well aware of those hazards and risks, and they do have the opportunity to decline that work, right? So it's not like that they're forced to do it. If they're made aware of the risk and they feel uncomfortable, then they can be reassigned. So there's a lot of opportunities for people to know what's happening.
Yeah, that's great.
Mm.
If somebody is exposed, are there symptoms to exposure that can be easily confused with other diseases, or are they very distinct?
Yeah, no, that's a great question. The sensitization is, as far as I know, it's relatively non-symptomatic. We just don't really know from that screening test. That's how we know that. Chronic Beryllium disease historically is often been confused with another disease that has kind of a similar presentation at first, and especially in the lungs, sarcoidosis, which often creates a lot of scarring in the lungs. And so that's historically a disease that has kind of been confused between the two. And there's been some research to go back and look at old cases to see if they were misclassified as chronic Beryllium disease and not sarcoidosis. So that's one that often comes up. Um, a lot of the pulmonary, a lot of pulmonary diagnoses can be difficult at first, right? Because they could present similarly, but one of the telltale signs with CBD is, an abnormal beryllium test, and then also looking at the occupational history coupled with some of those other things. So it really is a multi-phase, multi-prong evaluation to get there. But I would say if you're looking for something that really kind of mimics CBD early on, or it's kind of hard sometimes to tell, would be sarcoidosis.
Yeah.
Hmm.
Um, Next question is, how long does it take for chronic beryllium disease to develop after someone has been sensitized?
The short question is we don't really, or short answer is we don't really know. We've got a range of anywhere from a little bit under a year, around a year, all the way up to 40 years. That's one of those things that we'd really like to get a better handle on. So we have an idea that it's somewhere in there, but we're not exactly sure of a very specific latency period.
Yeah,
And and some people who are sensitized never develop CPD at all. So that makes it a little bit more unique as well.
yeah, that's
Mm.
tough. Um, is there anything that would be particularly helpful for health departments located in the same jurisdiction as a site to know about?
Yeah, that's a great question. I can't say this for sure, but I know where I work here, in Oakers, Tennessee, we're in Anderson County, and we've got a few Department of Energy facilities here in the area. They have their own, industrial hygiene departments and medical departments. I believe there has been some cross-pollination with, other medical providers in the area. I do know that there are some local hospital labs and some pulmonology offices who do see some of those patients. And so I believe there have been, lunch and learns and meetings and things like that. There's probably other things that occur I'm not aware of with physicians, but I know that people do talk about these issues, especially in this area, because it is something that does happen. I'm not sure if there's ever been any sort of briefings or updates with like the Anderson County Health Department. I think there may have been because I live in an adjacent county in Knox County, and I think the Knox County Health Department may have kind of attended some informational sessions where some of the physicians that work at the DOE sites here have talked about these issues. So I think there's some cross pollination, but I don't know if that happens at other sites. It may, but I'm not aware of that. So I don't know enough to tell you yes or no, I guess.
Um, Next question is, why is it important for us to recognize beryllium as a hazard, given that the sensitization rate is so low?
Uh, that's a great question. So I think the important thing here is to remember that sensitization is kind of the gateway to entering that pathway towards chronic Beryllium disease. And what we're really trying to prevent is chronic Beryllium disease. Obviously, lung cancer plays a role in that, but it's the CBD that we can kind of detect early on, or the likelihood of that maybe developing with that sensitization test. So because CBD has such an impact and burden, not just on the healthcare system, but also on the individual, right? It's a very terrible disease. So um, understanding the beginnings of that with the sensitization and trying to prevent that, or at least the early detection, goes a long way into either preventing or minimizing the development or the impact of CBD later. So.
Great. Well, I think that's all of the questions so for us. Thank you so much, Gregory. There's quite quite a few, a lot
No,
of
that's great.
yeah. So I just want to say thank you all for being here. I will put up the recording a little bit later, and I'll talk to Gregory about how to get the slides, so you have those all available to you too. And I hope that you will all join us for our next webinar Wednesday. Thank you so much.
Thank you.